Well, from one startup in the healthcare space that you brought us, here's another. Accessible and affordable mental health services remain a constant global challenge. Meet one startup that is addressing this huge gap using generative AI. Aishwarya Anand, my colleague, finds out how the company is bringing in preventive and diagnostic care via AI and deep tech to solve this issue.
What's the name of your startup?
United We Care.
And what is the problem that United We Care is solving?
1 in 4 people are dealing with mental health issues, problems, or disorders. And 3.5 trillion is the money that's lost in these kinds of issues. So that's a large part of the problem that we're solving.
India is home to about 280 mental health startups. What gives United We Care an edge?
We are actually one of its kind, and we cut across all 4 stages of mental health, starting from diagnosis, prevention, care, and post-care support. And in the middle of all this is our AI virtual coach. We lovingly call her Stella. Stella is CBT trained. She can interact in 29 different languages. She can understand the underlying situation of a person with 95% accuracy. The problem is severe. She will also connect you with the right clinician. So we are the ones who's bringing AI with human touch.
How important is the role that generative AI is going to play when it comes to healthcare and especially mental wellness?
The way I look at generative AI, I think it's the tool for us to get to billions of people. You are not going to find a clinician at 2 a.m. in the morning. You're not going to find a clinician which is always 24/7 available, or who will understand the social fabric and construct. And that's where AI actually bridges the journey, where you can have a conversation with her. She understands your problem, your issues. She will give you real-time tools to solve those.
What have been some of the most frequently asked queries on your platform?
It really depends on region to region. If I look at, for example, US as a geography, which happens to be one of our largest geographies, it is loneliness. It is how is micro-communities dealing. When I say micro-communities, it could be LGBTQ, or it could be immigrants that are actually in that country that are dealing with different kinds of problems. And micro-communities are the ones that are facing deepest level of mental health issues. And when I come to India, again, it kind of differs, right? So stress, anxiety are the 2 leading factors that we see. And now that could be relationships we see as trending very high. But there are undercurrents of, even micro-communities in our country, which is LGBTQ. It's brewing, smaller scale, but it's brewing.
How many users do you currently have on your platform, and how many healthcare professionals are you working with?
So overall, we get about 1 million users, and these are coming from different parts of the world. So US happens to be one of our largest market, followed by Germany, France, and India. We have over 100 clinicians in India and over 25 plus clinicians in the US. US is a market we just started about 6 months back, and we have already partnered with some of the largest insurance companies. We're the first company in India to bring mental health insurance in the forefront.
One of the biggest issues that we have seen when it comes to mental health is it's not affordable. How are you solving that problem?
There are 3 ways we're actually solving that problem. So number 1 is sometimes you don't understand the urgency of the situation, right? And then you keep putting it on the side that, hey, I'm going to deal with it at the right time. That's one thing that we solve through a generative AI, right? So if Stella, you come and you take a test on anxiety, and when you know that your anxiety levels are serious, is when you start to talk about it. And then we don't see that people straight away go to a clinician, right? People will continue to talk to Stella. So 200 sessions on Stella to 1 conversation with a clinician is what we see. And Stella conversations are completely free. As long as we possibly can, we would want to keep Stella free, because the idea is to make it affordable for millions and billions of people out there.
How has the fundraising journey been for United We Care?
So far we've raised about $3 million, but we are gearing up for our next round soon.
And when can we hear about the next round?
4 months at the top.
How has the business done in FY23, and what's your outlook for FY24?
So if I look at FY24, the business on books collectively is around $13 million. We are not going to stop till we reach billions of people.
What is your take on influencers coming on Instagram and talking about mental health?
There are many influencers out there that actually preach about mental health. They preach mental health, but when you go and seek out support, it is all monetary, and it gets into very different shades and areas. So yeah, I'm sure there are some good ones and there are some not so good ones. We listen to many stories. But when you act is when you know that there is a problem that you have. And that's how specific influencers or any solution has to be able to bridge that gap.